Everybody has heard of malaria, everybody has heard of dengue, but melioid is a very, very important disease in terms of the number of people that die from it, and yet very few people have heard of it. Unit now, which we now call MORU, Mahidol Oxford Tropical Medicine Research Unit, as a collaboration between the University of Oxford, Faculty of Tropical Medicine, Mahidol University, funded by the Wellcome Trust. So we've had researchers here from both sides working together, working in Thailand, working in other countries around the region. About half of what we do is malaria, but we're also interested in other diseases that affect the poor people, and one disease is melioidosis or melioid, and this is a disease which affects rice farmers. It's caused by a bacterium in the soil. It's very deadly. It kills several thousand people every year in Thailand.
This is a bacterial disease that is highly endemic in Thailand. The bacteria is named Burkholderia pseudomalii. It's a bacteria in the soil and in the water because our country have a lot of farmers, and farmers stay in the soil and water for long hours, some 8 hours a day in the rice fields. The bacteria can get passed through their skin and through their blood, and it causes the disease for the patients who have high fever, pneumonia, and half of them die. We know that this disease is very important in Thailand. It's one of the most important cause of death. And even in Sanpasit Thipasong Hospital, our main research site, we found that more than 100 die of this disease per year. And that's only just one hospital. And 100 deaths per year is much more than the other important disease like dengue or leptospirosis. And that's why we know that this disease needs a lot of support from the government, from the Ministry of Public Health to improve diagnosis, treatment and prevention for the whole country. The people can get infected from 3 routes. One is called skin inoculation, which means that it can pass through skin directly. You don't need to have wounds, it can pass through your barriers of the skin. 2 is ingestion, which means that you can get it by drinking water that have the bacteria, or you can eat it from contaminated things in your meal. And the third is inhalation. And with the evidence, it suggests that in Thailand, most important routes are the skin and the ingestion. Why? Because we did a lot of study and we know that most of our patients are farmers, and the longer they stay in the rice fields, if they don't wear boots, they are at high risk of getting the melioidosis. So we survey and we collected whatever the water that they are drinking, and we found that many drink tap water, village tap water, and we found that the borehole water and the well waters are commonly contaminated with this bacteria. So that's quite confirmed that the people mostly get it from exposed to the soil and water in the rice fields, and from drinking water or eat the bacteria. Mostly it's drinking. And this disease mostly go into the diabetic population or diabetic patients. So if you are high risk of the disease, you should wear boots and should drink boiled water. And this year, with the Department of Disease Control working collaborating with the whole researchers of the melioidosis, is going to launch a formal Melioidosis Club Thailand to be the connection between researchers and Ministry of Public Health. Second, there's going to be the national guideline for melioidosis come out by the Ministry of Public Health, and its collaboration between Department of Disease Control and the whole researcher network. And the third is the national policy for the melioidosis. It will come with the milestone, what they would like to improve the melioidosis. And when it take it as a national guideline, national policy, it will expand the impact more than just the research. This is like putting the real research to make the future with the whole of the policy makers together.